The ACT has experienced the toughest day of our pandemic response so far. 2 Canberrans with the virus have passed away overnight. They were residents of the Calvary Hayden Residential Aged Care Facility, receiving end-of-life care from the palliative care team. They were both aged in their 80s. I speak for the entire ACT community in sending our condolences and our love to the family and friends of these 2 Canberrans who have sadly lost their lives to the virus. The ACT has also recorded the highest number of daily cases since the pandemic began, with 52 new cases to 8 p.m. last night. 40 of the 52 cases are linked and 12 remain under investigation. More than half of today's new cases are household contacts. 17 were in quarantine during their entire infectious period, but at least 31 were infectious in the community. We have 11 people currently hospitalised and 3 in intensive care, all requiring ventilation. So today's increase in case numbers will come as a shock to many, but it's an important reminder that the virus is still very much active in our community. Every time you leave your home and interact with other people, there is a risk that you may contract the virus. And then what happens is you bring the virus back home with you and infect those you live with. Now, when we get to higher vaccination rates and we start to further reduce our public health safety measures, daily case numbers like this will become the norm. But we are not at that point yet. 40% of our community who are eligible for a vaccine are not yet fully vaccinated. And these are predominantly Canberrans under 40 years of age. Now, we have 2 weeks to go until the planned end of our lockdown, when we will reach what I hope will be nation-leading high vaccination rates. So in the next 2 weeks, which will be the toughest 2 weeks that we have experienced, we ask Canberrans to keep doing the right thing. You can't let your guard down now. We've come this far. We can't let this get out of control in the next 2 weeks. Please listen to the health advice so that we can end this lockdown as safely as possible. Now, one part of this is to continue to get tested. If you have any symptoms, come forward for testing. And 3,875 people came forward for testing yesterday. But with today's record caseload, we have several new exposure sites listed on the COVID-19 website. So please ensure that you are getting tested as soon as you can and that you isolate whilst you're waiting for your test result. Now, on the vaccination front, the ACT has become the first Australian jurisdiction to reach 90% of our population 12 years and over with the first dose of a vaccine. That is a tremendous achievement for this community. 329,312 Canberrans had a first dose of a vaccine up to close of business last night. What this means is that by the end of this month of October, we can expect over 90% of the Territory's eligible population to be fully vaccinated. This provides a very good level of protection from the virus in the ACT. But we're not there yet, and we won't be until the end of this month, which is why the next 2 weeks and the 2 weeks after that are critical for this community. Currently, our fully vaccinated coverage of the eligible population is just a little over 62%. So between now and when the lockdown is scheduled to end, we need to deliver tens of thousands of second doses so that we can reach the 80% milestone before the lockdown ends in the middle of October. There are still Canberrans who are yet to even get a first dose of a vaccine. So we are urging anyone who is waiting for their first dose to make it a priority. Make it a priority today, over the long weekend, or early next week. Now, we've been contacting people who have bookings in our system later in October and some into the first part of November. 5,127 appointments have been able to be brought forward in the last 2 days, but we need more appointments brought forward. There are Pfizer bookings available in ACT government clinics as early as this Sunday. And there are thousands of bookings that we can fill in the next few weeks. So please put your name against one of those bookings. If you've been putting off having a vaccination, please take the time now to talk to a trusted healthcare provider so that they can offer you advice on the best vaccine for you. We do this, we make this call for people to get vaccinated for a very simple reason. For every 1,000 Canberrans that we vaccinate, we can prevent around 100 hospitalisations. That's why this is so important. Turning now to National Cabinet and business and economic support. Next week's ACT budget will contain significant investments to support our economic recovery and to support more jobs in our city. The government will be using our budget to pump hundreds of millions of dollars into the ACT economy to support the strongest possible economic rebound. We've now paid out over $475 million in business support since the start of the pandemic, and this includes the ACT's 50% share of the joint funding packages with the Commonwealth. And today, the Minister for Business, Tara Chain, and I released details of a key industries package which builds on this business support program to increase economic growth and to create more jobs as we recover from the pandemic. Additional funding will be provided to help the recovery of our tourism, arts and events sectors. Additional funding will also support new business development, innovation, Canberra's exporters and our city's creative industries. There'll be more details in the ACT budget next Wednesday. National Cabinet is meeting this afternoon. The agenda is significant. It includes the vaccination rollout, Indigenous and disability vaccination plans, booster and third dose vaccination policy, public health system capacity, new Doherty Institute modelling, future approaches to test, trace, isolate and quarantine policy, future home quarantine policy, authenticated vaccination record policy, international travel for vaccinated Australians, aged care visitation policy, mandatory vaccination for healthcare worker policy, the role of ventilation in indoor spaces in reducing the risk of transmission, the reopening of schools, mental health support in our community, and economic and business support. This is a broad and far-reaching national agenda that the ACT continues to contribute to. I have no doubt, though, given the breadth of the issues to be discussed today, that many of these policy decisions will require consideration over multiple meetings. I'll report back to the community tomorrow at this press conference on any decisions that are made out of this afternoon's National Cabinet meeting. So in summary, for those who have joined late, sad news. 2 Canberrans who were positive COVID-19 patients have passed away overnight. And again, I extend our thoughts and our love to the family and friends of those Canberrans. 52 new cases, a number we didn't want to see, a record daily caseload for the ACT. But 40 of these 52 were linked, so we know where the virus is transmitting. 17 in quarantine during their entire infectious period, and at least 31 infectious in the community. And 11 currently in hospital, 3 in intensive care. This is a difficult and challenging day for Canberra. And I know everyone's thoughts will be with those who have contracted the virus and those who need hospital and intensive care. I'll now invite Dr. Coleman to provide an update on the overnight cases and the epidemiology, what we're seeing at this stage of our outbreak. And then myself, Dr. Coleman, Minister Stephen Smith and Commissioner Ray Johnston from the AMC will be available to take questions. Thank you.